Hola a todos. Mi nombre es Frankie Miranda. My name is Frankie Miranda, and I am the president of the Hispanic Federation. And I have the honor to serve as your moderator for our next conversation. I hope everyone found our immigration panel discussion engaging and thought provoking, and that you left the session with the key takeaways on how we can start turn the tide on behalf of our immigrant families. At the Hispanic Federation, supporting immigrant students and families will always be a priority within our programming and advocacy efforts. Everything we do during and after this crisis must be with a strong focus on building more equal and sustainable support for resilient families, which includes advocacy for mental health. We know that for many young people, school is the primary provider of mental health resources, and that there is no one way to address mental health support for students of color. Across the diverse pool of students, there can be a vast mental health differences in social stigmas and access to effective supports. Everything, everything can be very difficult to assess. Understanding these differences is critical to ensuring resources are allocated in a way that will improve mental health outcomes for all students. During our next session, we will attempt to share perspectives on the current challenges communities of colors are experiencing due to the pandemic and racial inequities. We also speak about the crucial need for mental health support and how organizations, schools, communities can foster an environment that provides these resources. And finally, highlight the importance of training educators in trauma-informed care to ensure students of colors are given the necessary help as school continue to fluctuate between remote, hybrid, and in-person models. Now, it gives me a great pleasure to introduce two incredible speakers for today's Fireside Chat session that will focus on how essential it is for communities of color to receive mental health support. As a trained social worker at Las Americas Newcomer School in Houston and founder of STAR Counseling, a nonprofit consultation organization focused on supporting survivors of torture, asylees, and refugees, and trainer with the Hispanic and Latino Mental Health Technology Transfer Center, our speaker has built her career working with immigrants and training educators on trauma-informed care. Please welcome Sarah Howell. Is Sarah with us right now? Let me see.
Thank you. Unfortunately, Sarah is going to be logging in a couple of minutes late. However, you can continue the program. Thank you.
Excellent. Now, let me see. Okay. And then Sarah will join us in a little bit of technical difficulties. Now, I have the incredible pleasure to introduce someone that has taken a great deal of leadership in responding to the COVID-19 crisis through numerous reports, partnership building, and continuous advocacy on behalf of communities of color. Our speaker is the president and CEO of the Education Trust, a national nonprofit organization that seeks to identify and close opportunity and achievement gaps from preschool through college. He has provided many educators with the tools to better understand how to support students and families during these times. Previously, he served in President Obama's cabinet as the 10th U.S. Secretary of Education. In tapping him to lead the department, President Obama called him an exceptionally talented educator, citing his commitment to preparing everything from child success and his lifelong dedication to education as a teacher, principal, and leader of school and school system. Please welcome Dr. John King Jr. Hi, Dr. King.
Hi, thanks so much, Frankie.
Yes, we are going to get started immediately because we have a very interesting conversation to do, and especially with the incredible challenges that we have seen in the last few months. Why don't we start, Dr. King, to talk a little bit about these challenges and how your organization's current work has been changed or have been modified in the recent months.
Sure. Well, again, thanks for the opportunity to be here and very much appreciate the leadership of the Hispanic Federation on these issues and the partnership in the work. I think it has to be said that this last 8 months has been an equity disaster for kids and families. In many ways, we've seen the inequities that existed before COVID-19 put into sharper relief and exacerbated by the crisis. And we see it at every dimension. We see it in health. We know Black and Latino folks are 3 times as likely to get COVID, twice as likely to die from COVID when they do. We know that for Latino communities, there's been a disproportionate economic impact of COVID. COVID has had a devastating effect on employment and income. We've seen a huge increase in the number of families that are food insecure. We've seen an increase in folks being housing insecure, and I worry, actually, as state moratoria on evictions come to the end, we're going to see even more homelessness amongst children and families. And we've seen a devastating educational impact. McKinsey did a study that showed when you account for the missed learning time in the spring and the disruptions to learning this fall, that we can expect on average 7 months of learning loss for all students, 9 months of learning loss for Latino students. That's almost a whole school year that we have lost that we're going to have to make up for. And we also know there's been this socio-emotional toll on kids. I was a kid who, for me, growing up in New York City, the thing that saved my life was positive relationships with adults and peers at school. Both my parents passed away when I was a kid. My mom when I was 8, my dad when I was 12. And I really relied on the consistency of school, the nurturing relationships with fantastic public school teachers. And so my heart breaks for kids who've now been without that consistency, in many cases, for months. To not have that access to adults, that access to mentorship, that access to positive reinforcement. And I worry particularly about kids who are in homes where they're experiencing health trauma, economic trauma, homes where there may be addiction or abuse. That's a heavy toll on kids. And then for some of those students, because of the digital divide, they're not able even to log into school. We know that there was a Pew study that showed 79% of white families have reliable internet access versus 61% of Latino families. So in many places, kids are locked out of school, locked out of those relationships, and then in difficult home contexts. So it's been a tough period. For us at EdTrust, what this has meant is even more robust advocacy across a wider set of issues. So we jumped into advocacy around food security, even though we're an educational organization, not a food justice organization, but we have 30 million kids every day who rely on school meals to eat. And so we felt like we had to jump in on advocacy to make sure that kids were able to get meals, even if their school buildings were closed. We're not a tech advocacy org, and I'm sure you have this experience too, at the Hispanic Federation, we have to speak to the issues of internet access, because not being able to access the internet is now a barrier, not only to education, but to accessing telehealth services, accessing benefits, looking for a job. So we've gotten very involved in advocacy to get Congress to put resources towards closing the digital divide. And of course, we're doing a lot of advocacy around stimulus funding. I am appalled that Congress has not acted on an additional stimulus package. We need money to stabilize state budgets. We need money to protect schools from cuts. We need money to address academic needs and socio-emotional needs. And I cannot get over the fact that Congress has not acted. And I can only hope that they will reach an agreement quickly to get resources to kids and families and communities.
Thank you. I think that when we spoke earlier this year, and we were on the on the height of this pandemic, New York was the epicenter. And you mentioned something very interesting about the different inequities that already existed before the pandemic, that pulled the curtain on everybody, and is very difficult to ignore now. And you mentioned a part of your life history, and it's interesting because we know that Black and brown students had been significantly affected by the pandemic, but our communities, while we think that the pandemic is moving in a different direction in different parts of the country, is going to have long-lasting effects. Our communities will have the higher rates of infection, loss of jobs, reduced income, and debt. And in fact, recently a study done here in New York found that between March and July, 1 out of every 1,000 students in New York State lost a parent or a caregiver to COVID-19. With the majority of these deaths recorded in New York City, Black and Hispanic children experience parental deaths twice at the rate of Asian and white children. And in this reality and everything that you have mentioned, how can we start having a conversation with institutions to recognize the need for more holistic support, mental health, and overall well-being?
Yeah, it's such an important point. I mean, this requires, I think, just a higher level of political will, right? This requires a level of commitment to say, we care about all of our kids. We want all of our kids to be whole. We want them to be supported. And we have an obligation to provide the services that they need. And so, this starts with access to counselors. We know that even before COVID, we had inequitable access to counselors. We had many students of color attending schools where they couldn't even see a counselor. 1.6 million kids who went to a school pre-COVID where there was a law enforcement officer in the school, but no counselor, right? So we have this need for kids to have access to counselors. We have a need for kids to have access to mental health services. In fact, the numbers suggest that a majority of kids who are accessing mental health services are doing so through school. So we ought to have a very significant investment. This is where Congress is needed, and states and local government, to say we're going to put enough resources in to make sure that we have a reasonable ratio of students to counselors, that we have availability of mental health services for kids and families, right? Because as you described, the devastating impact of COVID on kids and the loss of loved ones, well, that's also happening to families, right? That they're losing, people are losing their partner, their parent, their sibling, their grandparent. And so we need supports for families. We've done polling at EdTrust in New York and in California showing parental stress levels are through the roof. And so we really need mental health services available to kids and families. We need those services made available without respect to immigration status. One of the worries I have is that in the current political climate, there is a resistance to providing equitable access to healthcare services for folks who are undocumented. That is deeply problematic and immoral. Right, so we've got to make sure we get resources to all kids and families, and then in the long run, we got to see this as not just a COVID emergency of the next 3 months, 6 months. This is long term. The impact of these traumas on kids will be long term, and we're going to need to invest in these supports long term.
And it's very critical what you just had mentioned, because when a child loses a parent or a guy or somebody that is taking care of them, there is a 50% chance of them to fall into poverty and long-lasting effects. So if this is not just an issue of mental health, we're talking about entire communities that are going to have less opportunities to actually move forward. But I think that you have made a very good introduction and talk about so many different issues, but do you think that we're still missing the point on something? What is missing from this? Everybody talks about stress. Everybody talks about mental health. But what exactly is missing from this conversation? Is there something there that you feel that we should be talking or making someone accountable?
Yeah. Well, I'm so glad you asked the question that way. I mean, I think part of what folks are missing is that when people experience trauma, the one thing we know about what helps them to recover from that is relationships, right? It's relationships that build resilience. And so I'm very worried that we have school districts who haven't been in touch with kids since February or early March, right? School districts where they don't know where kids are. They haven't talked to their families. So there are some school districts around the country that have had massive campaigns. I think about the Phoenix Union School District in Arizona had a massive campaign. They called it Every Student Every Day. They have an adult who works in the school district who is in touch with every kid every day to check on them. Do you need food? Do you need access to a counselor or mental health services? Do you need a Wi-Fi hotspot? How can we help you, right? That relationship matters so much. I think about what we're seeing around distance learning and hybrid learning, where there's not synchronous instruction. And so kids are getting packets or assignments, but they're not actually interacting with their teacher. For some elementary school kids, the best part of their day is that moment when they do their morning meeting and the teacher is there with them and their friends, and they see their friends and they see their teacher and they check in and share how they're doing. Right? And we have to make sure kids have that. We have to invest in those relationships. When we think about academic learning loss, I think the best way we can respond to that is with a huge tutoring effort. We need a national tutoring corps. The United Kingdom is doing this. They are mobilizing tutors. And what's powerful about tutoring, yes, it's the intensive academic support, but more than that, it's the relationship. It's somebody, I know this is somebody who sees me, who cares about me, who's invested in me. And when we think about the trauma that we're experiencing as a country, part of the trauma is this isolation and folks not feeling connected to other people. And it's a problem for adults, but it is a deep problem for our kids. And we aren't acting with urgency. That's the thing that is unbelievable to me, that we're allowing this crisis to exacerbate our inequities. So you've got wealthy folks who have a pod and they're hiring a teacher to work with 3 kids, and their kids are getting all this additional support, and then we're leaving our most vulnerable kids.
It's absolutely true. You know, the idea of the tutors, and it's only a tool for the most privileged, right?
Right.
The most privileged. And another point that you mentioned is that, again, you know, from my perspective here in New York, when we were the epicenter, that we hoped that the rest of the country was going to learn some of the lessons from us, from the pain that we went through. One of the things that was most surprising to me was when schools in New York City started to reopen, and they interviewed those kids, public school kids coming to school, and they were interviewed, and they were really excited. I thought that they were going to be scared. I was scared. And they were just like, I just want to see my friends. And the point that you made about that connection is so important. It's not only for the parents that actually need to go to work, but also for that child that is really wanting to connect again.
That's exactly right. That's exactly right. And, you know, I will say there are school districts that have done a better or worse job of trying to do that in a virtual context. It's not the same. You know, there's no way you can recreate the personal interaction. But, you know, in some of the more affluent districts where they were able to invest in teacher professional development, teachers were able to use the technology in different ways. You know, even something as small as you create a project and you have your class on Zoom, but you create these breakout groups so that students are working collaboratively on projects with their peers. We can't say we're just going to pause human connection for a year and a half. That's just not, that is not healthy. Not healthy.
Yep. The many challenges that we're facing also is how to communicate with families that are struggling with the different demands, as we mentioned before, lack of income or loss of income, and many other different things, unemployment, food security, and anything. How can we, organizations, institutions, community groups, work together to centralize or streamline information for these families that are so overloaded and in many cases, relying with very limited resources in terms of technology?
Yeah. I mean, we have to create support groups for parents. We have to create communities for parents. It's a role that nonprofits can play. It's a role that schools can play. And we did some polling that showed that less than half of parents were in regular communication with their child's teacher during this period. So we've got to do a better job making sure that parents feel connected to each other and to their child's teacher. We've got to be more creative, whether that's the Zoom conversation or gathering outdoors or just having a conference call. But again, it's this idea that we've got to ensure that people feel heard and seen and supported. We've got to do this in a way that is translated. I worry a lot that, as a general matter, as a country, we do not do, to my mind, a good enough job supporting parents who speak a language other than English at home. But that's been even worse in this COVID period. A lot of the tech tools are not translated. A lot of the materials that have been sent home have not been translated. A lot of schools have not made translators available for their events and communications with parents. So we've got to be much more disciplined about saying we need to be in strong communication with all of our parents. Again, this is a role that nonprofits can play. They shouldn't have to, right? School districts should be doing this work, but certainly nonprofits can be helpful in saying, we know if kids don't complete the free application for federal student aid, they're not going to be able to access Pell Grants to go to college. We wish the school would do it, and we wish the school would do it in multiple languages. But if the school isn't, we as a nonprofit, we're going to do that support for parents of high school seniors. We know we wish the school district would do events to help parents understand how to navigate the technology, some of the technical assistance so that they can manage the different logins and the different materials their kids are using. But if school isn't doing it, then that's another place where nonprofits can step up and be that support for families.
It is, in your opinion, that this crisis is going to allow us to be better prepared for the next one, or we still in a reacting mode? Are we building something new? Are we building something better, or we're not there?
I think the truth is it's inequitable. So there are some districts where they now have made sure every kid has a device and every kid can get on the internet. So if there are closures, if there's closure due to storm damage, if there's a closure due to snow, if there's so forth, they now have a level of resilience they didn't have before. But I worry in places like New York City, Los Angeles, our big cities, we're still really far from that. We still have kids who haven't been in touch with school. We still have folks who have no internet access. Some of our high needs rural communities still have huge gaps in internet access. In fact, some school districts, we have teachers who don't have reliable internet access to be able to teach their students. So what we need, I would argue, is we need what FDR did during the New Deal around electricity, right? There was the realization coming out of the Great Depression that access to the 20th century economy required that you have electricity in your house. And so there was, through the Tennessee Valley Authority, this massive investment in trying to ensure that everybody had electricity. We need that kind of federal commitment today to make sure that everyone has the internet, right? Because how can you participate in the 21st century economy and sort of civic discourse if you don't have internet access?
Going back to our original topic in terms of the mental health support, not only for our children and our families, if you were going to just prioritize one thing that you can say, this is how we need to drive our agenda, or at least a couple of things? What would those two things be?
Yeah. So hard because there are so many challenges we have to face at the same time. I'd say two things. One is, as we prioritize relationships, we have to make sure that every kid has an adult that they're connected to. It could be a teacher, it could be a tutor, it could be a mentor from Big Brother, Big Sister, it could be the person who runs the after school or summer program at the local community center. It could be someone from their faith community, but every kid needs that adult that they're connected to, who they know cares about them and is supporting them. And we should, if you're in a school, and I thought about this a lot when I was a middle school principal, you should be able to go through your list, your roster of students, and you should be able to identify who is that adult who that child is connected to. And when you start to get to kids who you can't really name the adult with whom they have that relationship connection, that is a problem. And you need to have a strategy to address that. And that was true before COVID, but I think COVID has, exacerbated the urgency of that. And then the other is resources. I always say, the only people who say resources don't matter are people who are super rich, right? Because they're fine. But anybody who has needs knows money matters, resources matter. And if we don't see a massive infusion of additional resources from Congress, we're going to see school districts cutting. And you know who's going to be cut first? It's going to be counselors, mental health services. It's going to be non-academic supports. And that's going to be a tragedy. So we really need a massive infusion of resources to prevent cuts. And our analysis suggests it's, upwards of $250 billion that's required just to prevent cuts and sliding backwards. But then on top of that, we need a substantial investment to say we need counselors, mental health services available for kids and families, particularly in our highest needs communities. And we have the resources to do it. We're the wealthiest country in the world. It's just a question, do we have the political will to do it? Absolutely.
I'm going to give now an opportunity for some of the audience members to participate in this discussion. Jessica and Diana, do we have some questions on queue, or people want to grab their mic and ask a question?
Hi, everybody. We invite everybody to grab the mic if you want to ask the question. In the meantime, we do want to ask a question in the chat box that says, what do we do with the new virtual dropout kids that are no longer going to class and schools went virtual? What do we do when students are not engaging online and are dropping out virtually?
Yeah.
You can join by grabbing the mic. We will bring you on stage to ask your question. Thank you.
Yeah, I'll say quickly, this was a problem, again, before COVID. We had a problem of opportunity youth, young people who were disconnected from school that we needed to get back. I think school districts really have to invest resources in sending folks out to find kids. And, we have to go door to door, with masks, with appropriate social distancing, but we've got to go and find kids and try to get them back to school. We've got to figure out what's in the way. Is it that their family had to move because of a financial crisis? Is it that they don't have internet access? What happened? Are they in a homeless shelter? The city of Chicago is making a big effort to make sure that there are devices and internet access at all of their homeless shelters to make sure that kids are able to continue their education. So we need that commitment to say we're not going to let kids fall through the cracks. We also need to start thinking about programs that will re-engage students. For some students, the reason that they're not in school is they're working because their parents lost their jobs and they're able to work, so they're out working. So we've got to think about what are some work and learn programs that we might create so that kids can stay connected with school even as they're working. But we've really got to have a mindset that we can't afford to have a lost generation of kids here. And we have to be relentless about helping kids reconnect with school.
From our chat box, Yvette Bello from Hartford Foundation, our friend Yvette Bello, she said, I'm wondering what role can before, after care educational partners can play during this time, and what might those organizations be able to do that schools might not be able to do?
Yeah. Well, two things for sure. I mean, in some places where schools are closed or hybrid, right? Let's be clear about what hybrid means. Hybrid means you're only going to school a couple of days a week. That's a lot of time at home. What some nonprofits are doing, is they're providing that essentially learning environment for kids. So we have boys and girls clubs around the country they're open during the day, and they are providing, with masks, with appropriate physical distancing, they are providing environments where kids can do their work. They're trying to create for low-income students the kind of pod environment that affluent families are creating. They're trying to mobilize their nonprofit staff to support kids. It's useful to kids just have somebody who's checking in. Okay, what class are you supposed to be in now? What work are you doing now? Even if they're on Zoom, kids still need support and coaching, and nonprofits can play that role in the short run while schools are closed or hybrid. But then as we get back to, hopefully have a vaccine and we get back to regular school, kids are going to need more time. They're going to need more time to address learning loss. They're going to need more time to provide the kind of socio-emotional support they need. And so after school providers, summer providers could be a part of our solution there. Randy Weingarten, who runs the AFT, and I wrote a piece last spring arguing that we needed a massive federal investment in summer programming, right? And that could be done through nonprofits as well as through school districts. But we're going to need that. Summer 21, summer 22, we're going to need those kinds of programs that are both providing enrichment as well as academic support.
So I know that we are we have many questions, but we have not enough time. So I want to thank you so much for all your insight. Anything that before you say goodbye that you may want to add to this discussion?
Well, I just want to thank folks. I know we have a lot of folks who are part of this call who are working every day to try to support kids and families. And I just am so grateful that EdTrust is a part of this community of organizations along with Hispanic Federation that are trying to stand up for justice for our kids and families. And together, I think we can make it through this. This is indescribably difficult for kids, families, and communities, but we can make it through this. And we've got to keep saying to people, it's not good enough to go back to how things were before COVID. We truly have to build a more just, more equitable future. Thanks so much, Frankie.
Thank you so much, Dr. King, and I hope to see you in person very soon.
Yes, absolutely. I look forward to it.
Thank you so much. Bye-bye. Bye-bye. Thank you so much. Once again, Hispanic Federation is very appreciative of everybody's time. We know that the trauma of the pandemic will likely outlast the virus itself, especially for students of color. And we must continue to equip ourselves and community with the appropriate and racially equitable mental health treatment for all of our students. And we look forward to staying connected through all of this time. So for the rest of you, I'd like you to stay in our virtual room. We are going to be having a reception, right? We're going to continue gathering after this session, but we want to acknowledge everything that has been discussed and accomplished during these 3 days, and we are going to put together your recommendations on a report. I want to make sure that all of this and the team makes your recommendations so we can actually go to all the key stakeholders at the local, state, and federal level with all of these recommendations. We have a moment in time, and we need to make sure that we continue advancing our students and making sure that they have everything that they need during this pandemic and also afterwards. A heads up, you will receive an evaluation survey via email. We always value your feedback, so that is really, really important for us. So you can tell us what you thought about everything that we did, the speakers, the sessions, and everything, and even, you know, this new technology that we're using. So all the feedback. And I will be concluding by saying that there's an election around the corner, and that this is our time for us to make sure that we mobilize all our communities and all our family members to the polls, and that we make sure that we make our voices heard. So looking forward to working with each one of you, and I am confident that by working together, we're going to obtain a brighter educational future for our children. De nuevo, muchísimas gracias. Please join us at the virtual reception, which will kick off right now in this virtual room. This is a great opportunity to network with other attendees, and that we can continue the conversation. Muchísimas gracias. Thank you, thank you, thank you.